Now, we're looking at the MTHFR variant, and I look because my practice has a higher female demographic than it does a male demographic. I may start to look for female associated SNPs. For example, there's what's called the BCMO variant. This is a bone mineral density variant, and it is run by carotenoids and vitamin D. I definitely, as a female, want to know, or rather, if my patient is female, I want to know if they have a risk factor for bone mineral density concerns. So it's not just about what may be a hot button in my practice, it's also what may be common practice when we evaluate a patient. Are there more significant risk factors for females versus men? Which brings me back to this idea of the MTHFR variant. While it is well understood and accepted in the industry that women of reproductive years and during pregnancy, during breastfeeding, require folic acid as a part of their daily intake or nutritional intake, not just through healthy dietary choices like dark green leafy vegetables, but also through supplementation. I wouldn't want anyone to get the impression that the MTHFR variant is only important for a female for those reasons. The MTHFR variant is a methylation SNP, and the homozygous or TT form of this gene polymorphism indicates that an individual cannot use synthetic folic acid like that which enriches our food products like cereals and breads and pastas or packaged goods. An individual with a TT variant would be at risk, male or female, of not being able to metabolize properly synthetic folic acid, which is found in enriched food products. That means that there's a risk for unmetabolized folic acid in the individual, and this increases risk factors associated with bone mineral density, depression and anxiety, cognitive function as we age. It is a risk factor for poor detoxification pathways, inflammation, cardiovascular disease. It is a significant player in ovarian and prostate health. And so for that reason, unmetabolized folic acid or homozygous variant when it comes to the MTHFR dictates that this individual requires 5-methyl tetrahydrofolate, that this individual would not do well with an alternative form of folic acid. They require the folate itself. This individual then would be counseled to consume more dark green leafy vegetables. Whether it's philosophy or not, they would be encouraged to simply eliminate packaged foods that are enriched with folic acid from their diet. This is a point of intervention, a touch point for the practitioner with the patient to talk to them about the importance of natural food choices, getting food in its natural state versus in a fortified or enriched state, but in a convenient food option. Say what you will about convenience foods and whether or not they have their place. There are places where Gene SNP DNA analysis and dietetics would tell you that they don't have a place. And so this may be a way for you to have that conversation with a patient about the importance of consuming dark green leafy vegetables over enriched foods or food fortification for their nutrient or micronutrient balance. I'm looking here, and it's reasonable at the point that you get the results to want to know what you're going to do with that result. So I'm going to look at my patient's variant. We're looking at MTHFR right now, and I'm going to see that, and I'm going to correspond the result that I've written down on my cheat sheet to the column of the product recommendation. In this case, a B complex that is specifically activated with better forms of B vitamins. That folic acid I was talking about in the 5-MTHFR or the quatropfolic form. I'm going to look at things like mangosteen or acai berries for their benefits in energy, metabolism, and identifying that acai may be beneficial because of some of the amino acids that are in that product. But if I want that level of information about why B complex or why acai as a recommendation for one of my patients, I'm going to need to find that gene variant and that product recommendation in the Gene SNP DNA analysis product compendium that was put together. The Gene SNP product compendium was put together in the same order as the health practitioner guide, so that they could be side by side and you could learn about the clinical manifestations once you know the result and move over to supplement or ingredient recommendations. I know that this SNP, being a methylation SNP, is found in the back of my guide, and so I'm going to go straight to that result, and I'm going to see that this gene variant is associated with a sluggish methyl tetrahydrofolate reductase enzyme, and that B complex using quatrefolate is beneficial, that the acai is beneficial, and it's going to give me some insight into where other B vitamins like a slow release niacin may be beneficial if my patient were to report to me that they feel a little bit hyperstimulated by using a B complex. At that point, I know that the combination of things like quatrefolate or a B complex and niacin can be beneficial. But that information is found here in the product compendium, which gives us some idea of why and in what order to make a recommendation to a patient. Gives us some more of the clinical insights that may be beneficial in helping our patients be compliant or adherent to a treatment program. I wanted to end looking at the report by looking at a gene polymorphism that may not be that may not, as you read it, be intuitive. That the information or the suggestion of how to follow up with the patient may require a little bit more connecting of the dots. This is the what I refer to as the MCAR variant, but it is the MC4R variant. It's a member of a family of proteins that tell fat cells to quiet down or to stop maturation. The difference here is that this gene polymorphism's activity is on the adrenal glands or on adrenal tissue. So this gives me the insight when it comes to this obesity risk factor, when it comes to this energy factor, when it comes to this blood sugar factor, all of which this gene plays a role in, that my point of intervention is going to be stress and adrenal support, the HPA axis. Less to do with what we classically would think of when it comes to helping an individual lose weight by lowering their calories, by changing their dietary habits. These are all ways that practitioners may choose to work with their patient. In the case of blood sugar responsiveness, may focus on blood sugar herbs, may focus on medications that are associated with blood sugar management, when in fact this gene dictates for adrenal support, looking at the pituitary, the hypothalamus pituitary gonadal axis through the adrenal gland. That's actually the focus when it comes to this individual. So when you look at the gene on the health practitioner guide, you'll see that there's a longer red bar versus a short red bar. This means that this is a gene of significance, that this one has a stronger strength of activity in the body than a weaker or shorter bar gene variant might have. This gives me insight into also childhood obesity. This is a gene variant where obesity may have been have less to do with less to do with lifestyle and a lot more to do with family history. So now think of any other problem that we associate with obesity and family history, like blood sugar concerns or cardiovascular disease. Simply by having this result, we've really raised my suspicion of those concerns in a patient today or in the future. And this is a good point for me to talk to them about not just the fact that we will have an inherited obesity, that there may be a higher problem with this individual with a waist to hip ratio that is out of health ranges, where I may have more central obesity than hip obesity, meaning that cardiovascular concerns are of a significant risk in this patient. In fact, this gene polymorphism, the literature shows that that this gene polymorphism presents with greater than 2 centimeters of excess waist circumference when compared to other gene polymorphisms, and that this gene polymorphism is highly susceptible to increasing inches around the middle or obesity should they be put on medications used for depression. So it's important for us to think about all of the different ways that Gene SNP can help us identify places where we want to go as practitioners and places where we need to tread lightly. And all in that conversation, being able to identify a unique point of intervention and a different treatment option for the patient, where this individual would be unresponsive potentially to those medications. It would increase their risk for obesity, and the focus would be more on adrenal health, not just on the neurotransmitters associated with depression and anxiety. This individual also may have sexual dysfunction and insulin resistance. So this is a pretty comprehensive gene to look at. It's one that I want to know out of the gate if my patients have, because it is complex and there are multiple points of intervention, but those points of intervention are not what we standard think of, or we would think of in standard approaches to obesity or depression. And those are just some of the nuances of the Gene SNP analysis or reading the Gene SNP report. We're going to continue to make short videos to help you read the report, identify which of the SNPs are associated with blood sugar regulation, which of the SNPs are associated with cardiovascular health, methylation pathways, concerns that we have with sleep and behavior. We'll continue to work through these genes, the reports, and help you identify best ways to help your patients and your facility use these results and get better patient outcomes.